New nurse asked my mom how to take temperature of patients without mouths, then suggested feeding them through their nose. My mom was a nurse for 40 years. She was the head of her department and had to train new nurses. One day, she was teaching a new nurse how to take a patient's temperature. She showed her how to use a thermometer and told her to put it in the patient's mouth. The nurse looked confused and asked, "What do I do if the patient doesn't have a mouth?" My mom was shocked and asked her what she meant. The nurse said, "Well, what if the patient doesn't have a mouth? How do I take their temperature?" My mom tried to explain that all patients have mouths, but the nurse didn't understand. My mom then asked her how she would feed a patient without a mouth. The nurse said, "Oh, I would just put the food in their nose." My mom was speechless. She couldn't believe that this nurse had gone through nursing school and didn't know that all patients have mouths. My mom had to explain to her that all patients have mouths and that she would never encounter a patient without one. The nurse still didn't understand, and my mom had to spend extra time training her.